there is a new promising treatment out there that we are finding out about that's available locally that could potentially postpone treatment for type 1 diabetes patients. Here to talk more about this from USA Health is Dr. Melissa Perez Garcia. Thank you for coming by.
Thank you, Leanne, for having me.
Absolutely. We were talking earlier a little bit about type 1 diabetes, and we're seeing more of that in the community. Why is that?
We don't have a clear reason. I think the incidence is just rising with more autoimmunity going around in the country. Yes, there are better ways to diagnose it and sooner rather than later, but still, I think irrespective of the diagnosis techniques, the incidence is just rising.
Okay, and so that's where this treatment comes in. First of all, what is the name and how does it work?
Sure, it's teplizumab infusion. It's you have to give through an IV infusion every day for 14 days, and it has to be a specific candidate for this infusion. You know, the research trials were done, I think they were published when I was in my last year of fellowship back in 2019, but the medication has been available for use since 2022. Okay. The tricky part is catching the right patient at the right time.
Yeah, so talk about that right patient. Who is a candidate?
Sure, so I think the best way to explain this would be going back into what's type 1 diabetes. And so it's an autoimmune condition. So as we all know, the immune system is in charge of fighting external agents. But in some predisposition situations, your immune system just starts attacking its own body. Specifically in type 1, it attacks the beta cells in the pancreas, which are the ones in charge of producing insulin. So when you get that immune attack going, you produce substances like antibodies, which now we have the ability to measure commercially. Just order lab results. There is about 5 of them available to be checked. And so at that point, you could potentially detect patients that are having this immune attack undergoing. And then the candidates will be the patients that start having abnormal blood glucoses, but they are not fully blown diagnosed with type 1, which is when you have the high blood sugars.
Right. So essentially, it is, postponing type 1 diabetes.
Correct.
What else could it possibly be delaying then?
Sure. They have used this medication in many settings, also patients that have already been type 1, and it's shown that they can decrease the insulin needs for a very brief period of time, but they still end up the course of the disease at that point is already going. So there is not other outcome that has been established, and right now it's only used for prevention of symptomatic type 1 diabetes.
So this therapy, as I've heard, is being described as really hope for people. Would you say that's correct?
Yeah. Previously, all we have to do is, when you get a patient with type 1 diabetes, it's a whole new life adjustment.
Yeah.
At that point, especially for pediatrics, they have to be exposed to needle sticks frequently throughout the day, both to check their blood sugar and also to administer insulin, which will be the life-saving medication for them. But at this time, it's hopeful to be able to offer another choice for family members, especially first-degree relatives of patients affected, that we could catch before they become symptomatic.
Okay, I wish we had more time to talk about this because I find it all very fascinating. Is there anything else you want to add?
No, I think the main thing is encouraging primary care providers to screen patients, first-degree relatives of patients with type 1 diabetes, to be able to detect those cases that are at risk for. And then if they have 2 or more positive antibodies, they can refer to pediatric endocrinology.
All right, awesome. Thank you so much for stopping by.
You're welcome. Thank you.